Good evening, Dr. Maddox. I'm Ron Bronner. This is my PSA recording for SWK 586 Integrated Healthcare Policy and Services for April 14th, 2024. I'm a newly hired medical social worker at Sonoma Specialty Hospital. I actually start on the 30th of April, which is my birthday, which is cool. The services that the hospital and myself are going to be doing linkage and referral services for homeless patients and general patients in general are going to be respiratory and ventilation care, ICU to ICU transfer, hemodialysis, surgical services, IV antibiotic therapy, rehabilitation services, wound care. We have registered dietitians and nutrition staff within the program. We have palliative care. The average length of stay at the hospital is 25 to 45 days. We've had some major problems with discharge planning. Is one of the reasons why I was hired. Is I'm familiar with doing discharge planning from day one. I will be working with an interdisciplinary team of clinical case managers, doctors, social work staff, a psychiatrist, nurse, and other staff. We will be meeting on a weekly basis to review patient progress and help them with linkage. The interdisciplinary team approach will be used, both myself and the other social working staff, to help the doctors and nurses basically plan the linkage, provide the needed services, and I'll be scheduling medical appointments, dialysis appointments. With regard to the homeless patients that I'll be working with, I will be assisting them in locating a bed at a local shelter, possibly the Redwood Gospel Mission, Sam Jones, Cots and Petaluma, just to name just a couple. If client have dual diagnosis or are in need of SUD services, I'll be working with local other nonprofits, i.e. again, the Redwood Gospel Mission and other organizations to help them detox as part of these services. I'm familiar with working with patient families and providing other services and these services will be tailored to the patient. I'll also be assisting with access referrals to local Sonoma County Behavioral Health and the access program, and working with a psychiatrist there or behavioral health. A lot of the homeless, do work a lot with the county, and I'm very familiar with those processes. We'll also be working with local psychiatrists, outpatient care, and home health care, or possibly helping the client get to a higher level of care, i.e. memory services. All the services will be tailored to the client's needs. Sonoma Specialty Hospital is Sonoma County's only long-term acute hospital. We're located in Sebastopol, California, and we're located at 501 Petaluma Avenue in Sebastopol. Phone number 707-823-3166. And again, the services that we'll be working on is respiratory and ventilation care, ICU to ICU transfer, hemodialysis, surgical services, IV antibiotic therapy, rehabilitation, wound care. We do have registered dietitians and nutritionists on staff. Palliative care, average length of stay again is 25 to 45 days. Discharge planning will be done from day one, and I'll be doing a lot more. I do have established relationships with the local shelters. We have here in Sonoma County a HMIS system that I'm also very familiar with, and I've worked with a lot of the organizations over time. So I do have, established relationships, and these established relationships will be very helpful to get the clients into the shelters, which we've had a major problem We've had major overruns with regards to cost because people are not getting in the shelters. So again, thank you for your time, and hope you enjoy the presentation. Have a great day. Bye.